from Lancaster University, and my area of research is spatial statistics over like epidemiology and NHS data sources. So my research title is the statistical modeling of NHS Open Data Sources, and it's about detecting the sort of missing opportunities in such big open data sources, so we can learn more about it instead of just wasting the data. So what I'm trying to do is trying to do some spatial temporal statistical models over the data, and then hopefully be able to learn about the GP prescribing rate over them. So see the difference in GP prescribing rates, for example, and see whether it's a matter, whether that we can detect some more information about certain disease or drugs just from the prescribing rates and stuff. I think it's important, as I said, that we're trying to detect the missing opportunities in the huge data set. So in this way, we can learn more about it. And the spatial temporal models can help with, for instance, informing the decision-making on healthcare sort of areas. And then it can potentially help us to detect some urgent phenomena earlier than we could before. So the impact of my research will be hopefully finding more information, useful information, which can help us to make future decisions over healthcare from the big data, which we can obtain easily now. And I think the exact impact remains unclear at this stage of PhD, as I haven't really got like a full scope of what's going to happen next. But I think it'll be a nice way to use statistical models to sort of distinguish the chance fluctuations in prescribing, GP prescribing, just from the difference in the prescribing rates and stuff. And it will be much more efficient than what we are doing now. So the best thing about the PhD Symposium for me is I get to meet a lot of other people from different backgrounds, because I have a math stats background and I practically know nothing about medicine and epidemiology to start with. And from listening to what they are talking about and presenting, I sort of see more sort of clearer path of where my statistics can be applied. Sort of, I can see more about the interest in epidemiology. Like before this, I didn't know whether the thing I'm doing would be of clinical interest or something like that. So after my PhD, I'm considering keep going into the academic path in sort of spatial statistics using like Bayesian methods, those similar track as what I'm doing now, I think.